say the EBP presentation and a big overview, and then I'll break it into smaller chunks as we're going along and introduce part of that. So let me go to my slide presentation here. Okay, so first of all, just what the EBP paradigm is. It really is looking at how we can deliver high-quality patient outcomes. And this is done through research and evidence, clinical expertise, and patient preferences and values. I have a little annotator here so I can use this. Is that working? Spot up there. So if we look
freaking on home, and I was just like, oh god, I'm gonna freaking like
here at this patient preferences and values. You know, that really is when we talk about that constructivism piece. When we have positivism here and findings from empirical research studies that have to do with just hard sciences, and we combine them with the patient preferences and values. And all of that helps us to make clinical decisions so we can change our practice. I'll go to the next slide. Turn off my annotator. And so the Johns Hopkins Nursing Evidence-Based Practice Model kind of shows how this all works by saying, first of all, we have to start the questioning process where maybe we challenge the status quo. And we say, why are we doing it this way? You know, we can't just say it's because it's always done this way. We really need to ask this question, find the evidence, and then translate that into practice. And that becomes best practices with practice improvements, clinical learning, operational, and then we go back and ask, is that working, that change we made? So that's really evidence-based practice, that our practice is based on the highest level, robust evidence. Can you guys see these two circles here?
yes.
How do I get those off of there? I'm going to stop sharing my screen so I can share again. Hi, Lauren.
Hi.
Welcome.
Good morning.
Okay, so I think the little screen circles are gone. We have steps. The grand, big, overarching steps in our EBP is to develop and search a clinical question, to critically appraise the evidence, and then to implement best practices based on what we found. So week 3, we already did step 1, right? We completed, we asked the clinical question, and what I really had recommended for readings was in step 1 were these evidence-based practice step-by-step series. Let me see if I can pull that up. I have 2 monitors and I have like 8 different screens open. Not that one. Here it is. So are you seeing my screen here with the series?
Mm-hmm.
Good. Okay. So my phone just went hi. I don't know why. So here we have this link is in your resources. So for EBP, there's this series here. The Arizona State University has put together a series for evidence-based practice, and here we can see it's broken up into those 3 parts: developing and searching the clinical question, appraising the evidence, and implementation. So really week 3, we've already done this one section here, right? We looked at how the key steps in evidence-based practice and developed our clinical question. So those are the research articles for resources for that, and chapter 2 of Pollitt and Beck is also the EBP chapter in our course text. So when we're going to start into our EBP, we're going to have 25% of our grade based on this. This is week 7, right?
Yeah.
I think this is week 7. So you guys have another group project due. And I think kind of this week 7 and week 8 are a little bit lighter, but I'm going to say to you now to get the most out of our EBP assignments in these next weeks. I think it's really imperative that you start preparing now for looking ahead. So I just put this slide together about things you can do now to start preparing for our EBP section of our course. So look at your PICO and think about, is it still making sense to you? Is it still something that you want to use for this project? Format a table and start collecting all your information about some of the articles that you've already found and put them into this table. And so I put a link here for an example of a table, and I have a picture of that coming up too. Make sure you've read those first 3 articles in this series here about the first steps in evidence-based practice. Read Pollitt and Beck chapter 2. And then there's 2 websites we'll be referring to. One is the Johns Hopkins Center for Evidence-Based Practice, and I have a link here. And the other one is the Joanna Briggs Institute for Research. Let me pull those guys up. Not that one. So we have here is the Joanna Briggs Institute. They have a lot of information about evidence-based practice, but we'll primarily be looking at their critical appraisal tools. You can see they have, based on any type of study or research article you might find, they have a little checklist here. So here's qualitative research. You click on that, and it can bring you to this a checklist for how you assess a study for quality. Okay? The other one is the Johns Hopkins Center for Evidence-Based Practice. And so it has the model and tools are on here. And then this is the table here that I thought really might work well for you guys to, that works if I bring that over. So that's the individual evidence summary tool that I think is a good idea that you guys start using as a repository for all the studies that you're going to be finding to answer your PICO question. You guys have any questions so far?
Jill, are we going to get a copy of your PowerPoint?
Sure.
Yeah.
And if I forget to do that, please remind me.
Okay, thank you.
Yeah.
So right now we're still working in the groups, but we should be starting on everything for our own.
Yeah, I think this what you're going to be doing now is actually going to that JBI site and just using that checklist for systematic reviews. But the checklist can be used for any type of review. So you have your basic research studies where you're doing an intervention, and then you have your review studies where you're looking at a review of all the other studies that have been done on this topic. So that's what you're doing this week. You're looking at, they're called filtered sources because people have asked a question and got together a bunch of information and looked at this information, synthesize it, and spit out the other end. You know, this is what we think based on all these studies. So you're going to be using that JBI checklist on 3 different studies, and I did tell Vanjie if there's one that you prefer to use outside of what I gave you in that list on Sakai of review studies to look at, go ahead and feel free to pull one of those in. But I'd like you to at least try to do a meta review, and be a meta-analysis, a meta-synthesis, a systematic review, and one integrative review.
Mm-hmm.
So I think that you have this whole week and half of next week to do all of that. So during that time, it's kind of light where you can start working on your EBP project.
Okay.
So I know I'm looking over there, but I have two monitors, so I know you're there, but I have you guys over there. Did that answer your question, Lauren?
Yes.
Okay. So if you can start, looking at all this stuff now, it's a good idea.
Okay. Yeah.
So week 9, so week 8, you're going to present your JBI checklist, and I resent this morning a list of the groups for the JBI checklist assignment because I realized I had printed out an old roster with 2 students that had dropped. So look at that list that came out this morning. So week 9, you're going to be focusing on finding answers to your PICO question. So really some of the key readings for this would be that one of those articles from Arizona State, the step-by-step searching for the evidence. I really like how this article goes in and tells you how to find keywords, what databases you can be looking at. It can tell you what inclusion and exclusion criteria or what parameters to use. So this could be a great one just to help you through the process. So you're going to look at the levels of evidence that best answer your PICO question. So if you have a PICO question about maybe patient preferences, or remember last week you guys had looked at that article about, was it the quasi-experimental article about debriefing? It's like, that's not super high risk, right? So would you need a meta-analysis of systematic reviews to change the way you practice teaching nursing? It's versus maybe if you had do you want to give gabapentin for seizures or phenobarbital? I mean, that's really high risk. I mean, so that might say that, okay, when I have my level of evidence, I really need something that's really high level. I am changing clinical practice that is life or death, so I need something high level. But if you're just saying like, okay, how am I going to teach nursing students? That's important, but you can maybe use something based on only qualitative evidence. That's maybe that's not the best example, but hopefully you understand, get where I'm going with that. So right from the beginning, say like, okay, based on my PICO, what kind of evidence do I need for me to change practice? So that's that first step. And then you're going to look at the databases and determine, well, first you'll find your keywords. Then you'll determine what databases you want to search. So you're going to look at CINAHL, PubMed, Medline. Is it if it is kind of a patient preferences qualitative, maybe you want to look at PsycInfo as one of your databases. So we'll do that this week. You get your keywords and then define your parameters or your inclusion-exclusion criteria. And then you're going to track this process of going through and finding your articles, putting them into the search, the databases, and how many came out of those, how many did you look at and say, hey, I'm not going to use these, and what your final number were. So you're just going to take us through develop a Prisma diagram that helps you show others how you came to these final articles that you're going to include for your EBP project. Does that make sense? And then for our week 9 discussion, you're going to share your Prisma diagram, and then you're also going to tell your classmates why you chose the level of evidence you did, the years and the databases you searched, if you used, what type of articles you included, were they peer-reviewed, English language, were they empirical studies only, or did you include review studies too? So you take us all through that process. So during that week 9, I can give you feedback. Your classmates can give you feedback, and we can make sure you have the final number of articles that you'll include for the following EBP assignment. Okay?
Okay.
Okay.
All right. Week 10, I just started out by giving you the next 3 articles in that Arizona State step-by-step process here. So those are here. They're an introduction to gathering and evaluating and recording evidence, digging deeper, examining the keeper studies, the process of synthesis, seeing similarities and differences. So that's really what we'll be doing in the week 10. Week 10 is going to be a heavy week, so just if you're prepared for it, I think it'll go smoothly. If not, then it might not go as smoothly. So just recommend, that you just during these next few weeks keep asking questions, keep reviewing the resources, and make sure that they're clear.
Okay.
Really putting information into this tool, starting, from week 8, getting prepared with putting information in there that you might already have, and week 9, putting all your studies into this this individual evidence summary tool. It's really recommended here. So they have the article number, article and date, evidence type, the sample, I don't have my glasses on, what's that say? Sample site, and setting. Findings that help answer the EBP question. So you're saying, should we use normal saline pre-suctioning? So if this one article says, no, we shouldn't use it, then you can put this article said, no, we shouldn't use saline before suctioning. This one had mixed reviews. So then the measure, so how did they measure this? Maybe some of the weaknesses or limitations of the study, and then the evidence level and quality. So the next slide, I go into that one little column a little bit more. So how are you going to determine the quality and the level of evidence of each one of these studies that you found? So the first one is the level of evidence. It comes from the page 25 of Pollitt and Beck, and it's also on the insert to our Pollitt and Beck. There's that little pyramid there that has the level of evidence. So when they're asking you here, what is the level of evidence, you can put the actual number there. You can put, it goes 1 through, it has 7 levels, it looks like. So you can put the level there and the name of the level. And then for the quality, it seems like that's such a small little thing right there that they tacked on, but that's actually a huge part of evidence-based practice, making sure that you're using high-level evidence, but also that it's quality. So they're talking about the validity and reliability of quantitative studies and the trustworthiness of qualitative studies. So those are where we're doing our critical appraisal to find out what the quality is of these studies. And so when we look at that Joanna Briggs Institute website, and I showed you how there was those checklists there, that's really what you're gonna do, the checklist for each of the articles that you're included in this table. and then you're going to report out on the findings from the checklist here. So I went through, I had an article, went through the checklist. It said that more research was still needed, but the study overall was a high quality study. So it's a reliable study, so we can trust the findings from it, and that's what goes in this final column here. So that's a big step there, going to, first of all, looking at your study, identifying what type of study it is, and then choosing the appropriate checklist, going through the checklist, and seeing what the final results were. And then deciding, am I going to use this in my final recommendations? Any questions on that?
Hey, Professor,
Yes.
is the checklist something we have to turn in?
There is one, is it a discussion or an assignment? Let me go into Sakai, but you do have to do it for one of your studies. You have to turn that in.
Okay.
Okay. But really what we'll have here is a summary of what you found for all of them.
Okay.
So let's go to Sakai.
Will that be part of our EBP assignment, like one slide?
Yes.
Okay.
So assignments, make sure I don't have anyone's grade showing here. It must be a discussion forum. And I think it might be week 10, critical appraisal here. Using one of the articles you are evaluating for step 3, critically appraise the article using an appropriate appraisal tool. Report out to the class about the quality of the research article, include references in APA format. So that's where you'll do that critical appraisal tool there. Good question. And then the final step really is, when you've got this table here, is to make recommendations. Are you going to change practice based on what you found in the research, in our knowledge base there? Sound easy?
Sound manageable.
So what I think I'll do is I can post individual little videos about each part and give you some examples. And, please, when anything is not clear, I made a lot of changes. 508A was offered online for the first time last semester, and it didn't always flow so well, so I made some changes for this semester. And I noticed that sometimes some of the changes didn't get made. So anytime you look at something and say, hey, this doesn't make sense, it's probably not you, it's probably the class. So just go ahead and, shoot me a text or email or whatever.
Okay.
Okay.
Professor, quick question.
Yes.
How many articles do we need to support our EBP assignment? Is there a certain limit you want?
I think 3 to 4 would be the minimum.
Okay.
That would be a manageable chunk for you to do a good job on.
Okay.
10 would probably be the maximum.
Okay.
I think that would be tough. So really, what the purpose of this course is to show you these steps when you want to actually do this, when you go into a clinical setting and you actually want to check and say, hey, why are we doing something this way? That you'll know the steps to do it. So what you might find here, 3 to 4 articles might not be enough unless they're all, high level meta syntheses for you to actually recommend to change practice. But I want you to see clearly how to go through each of these steps so you can duplicate it when you're in your clinical setting.
Okay.
So better to do, I think, fewer studies, than actually come out with a workable EBP practice change that you can take, to your clinical setting. But this could be the foundation for one. So are you guys happy with your PICO questions that you have?
I am so far.
What did you have, Angie?
It's the psychotherapy for treating depression versus medicine.
Ooh, that's a good one. And what do you have, Howard?
It was the cervical collars for trauma patients.
And have you found that they're not using those as much?
We still use it quite often. But I'm going to talk to our trauma nursing person and see if she can help me with some evidence that she might have collected herself.
Oh, great.
Yeah.
Cool. And Lauren?
I'm just doing the use of the SBIRT.
Oh, good.
Kind of in the outpatient setting why it's not being used, but that it should be, essentially.
Great. Yeah, I know Dr. Reed, Dr. Reed, the chair of your
Yes,
group.
yes, yes.
She's done a lot with SBIRT, and APU has done a lot with SBIRT too. So if I have any resources that I see come through, I'll send them to you.
Yes, yeah. We've been trained on it at our facility. Just the yearly trainings you have to do, but it's not like a part of the actual MAR and or the EMR. I guess the questions aren't a part of it. So it's just interesting that if there's that evidence saying how critical it is, especially for substance abuse patients, which is pretty much every patient we see. But it's like not actually something we're doing. So
that's the perfect time to do.
Yeah.
EBP.
Yep.
Okay, well, I'm sorry about the confusion about the JBI group assignments. Any other things clarify? Okay, well, thanks for showing up. Appreciate it.
Okay, thank you.
All right.
Thank you.
Take care, guys.
Bye-bye.
Bye-bye.